My name is David Abrams. I'm the EMS Director for Charleston County EMS. I think the citizens can do the same thing that we're doing as an EMS agency, which is to listen to the experts and the CDC and our local leaders on their guidance, and to social distance, to stay at home when they're told to stay at home, to help really break the cycle of the infection, which will help keep that infection rate low enough to where we can manage the people who are sick and who need the services that we have around the area. The Consolidated Dispatch Center is starting by doing enhanced screenings. That came from a directive from the governor as well, as the CDC has made the recommendation. So we're doing screenings in advance. We're also asking our fire department responders, when they typically would have responded to a call and gone to make patient contact, if it doesn't appear to be or doesn't sound to be like it's a critical patient, for them to just stage and wait for EMS to do the initial approach so that we can minimize their exposure and also the number of people who actually make the patient contact and risk exposure themselves. So those are really the major things that we've changed to how we approach a call and how we better protect our responders as well as the community. Fundamentally, the PPE has remained the same. What has changed is our approach to using the PPE and the resources in which we're used to get them. So we've always had the N95s, we've always had gowns, we've always had goggle and eye protection. What we've done differently now, though, is with the scarcity of it, is to look for other options, other ways and guidelines, as long as the CDC has been changing their guidelines as well on the types of mask and how to use the mask. Fortunately, right now, we have enough PPE that we don't have a shortage, so our employees are still benefiting from the original guidelines, which is a one-time use and discard. And we hope that we can maintain that over the next several months with the adequate number of PPE that we have on hand. I think the morale has circled around a common goal to continue to serve the citizens of Charleston County. And that's a commitment that our employees have always had. So nothing has changed for that. What's changed, though, is the seriousness of which we're trying to break the spread with the social distancing, the really getting into the disinfecting of the ambulances every shift, every call, and really focused on protecting the patient from the invisible viruses that are causing this response. So the commitment for our employees has never been stronger. I will say that this community is very blessed with having an integrated form of government partnerships. So there's a lot of communication from our leadership. Our leaders are talking to the experts. They are supporting the first responder and the health community in ways that I don't think is shared around the other parts of the country. And I think we're seeing that effect with having all of the equipment we need, having an integrated response and approach to address this from a community standpoint. So the community of governments and leaders is really attacking this from a global perspective locally. And I think that's making a huge difference in what you're seeing in the Charleston area.